everybody. I am Dr. Aparna from Department of Oral Medicine and Radiology. Today I am going to talk about radiation protection in this video. So before going into the video, I would like to ask these questions on radiation protection. Why do you need radiation protection? Is it really harmful? If so, what are the harmful side effects of radiation to the body? Who really requires radiation protection? Is it the patient, is it the doctor, or the common people? And when do you actually apply radiation protection measures? Is it during the procedure, before the procedure, or after the procedure? It's all totally confusing, but I hope that with this video you will be able to get a clear idea on what are the importance of radiation protection. So let's go into the video. First, let's see why radiation protection is important. X-rays or X-radiation causes biological changes in the living cell and adversely affect the living tissue. Many of the early pioneers in dental radiography suffered from adverse effect of radiation. Many of them lost their fingers, limbs, and ultimately their lives to adverse effect of radiation. In the present world, now that the hazardous effect of the radiation has been documented, it is important that radiation protective measures are implied for the dentist, the patient as well. When a human body is exposed to radiation, it results in stochastic effect or deterministic effect. So first let's see what is stochastic effect. Stochastic effect occurs due to a result of interaction of X-rays with the DNA which results DNA chromosome which result in genetic mutation leading to cancer, tumor and other diseases like leukemia. It occurs as a direct function of dose. The probability of occurrence increases with the increasing absorbed dose. There is no dosage threshold and the severity of the effect does not depend on the magnitude of absorbed dose. Now let's see what is deterministic effect. The deterministic effect occurs due to a significant cell death or a cell injury which leads to obvious functional impairment of a tissue or ultimately the organ. So the deterministic effect examples are your skin erythema, loss of hair, and there is going to be radiation sickness, decreased fertility, cataract formation, teratogenesis and fetal death. So what happens in deterministic effect? It has a particular dosage threshold and the deterministic effect occurs only when it is going to be exceeded. The severity of the effect is going to be dependent on the magnitude of the dose that is absorbed. So because of an identifiable threshold dosage level, appropriate radiation protective measures can be implied and occupational exposure dose limits can be set. Hence, we can reduce the likelihood of effects of these occurring. Moving on, I would like to say that who requires radiation protection? So, the patient, the dental specialist or the radiographer who is taking the X-ray and as well as the common people. It is all of them who has to be protected from the radiation. Next, when can you apply radiation protective measure? It starts before the procedure itself. So how can you imply these steps before the procedure? So by proper prescription of dental images, limiting the amount of X radiation received by a dental patient by proper prescribing or ordering of dental images. The dentist should make a professional judgment on how to order the number, type and the frequency of dental images. Every patient's dental condition is different and consequently every patient should be evaluated for dental images on an individual basis. Examination should never include a predetermined number of images, nor should images be exposed at a predetermined time intervals. And proper equipment. It is very important that you check the machines or the equipment in the dental clinic setup. They should have proper filtration. So a filtration is nothing but a part of the X-ray machine where it is used to remove the long wavelength X-rays. So your X-ray beam consists of different wavelength of radiation waves where the long wavelengths have low energy and they are going to be more harmful to the patient and contribute to less diagnostic information, whereas your short wavelength X-rays are having higher energy and they have more diagnostic information and they are comparatively less harmful to the patient. So, your filter basically removes the long wavelength X-rays and allows only the short wavelength X-rays to pass through it. So, your equipment should ideally consist of 1.5 millimeter thickness of aluminum filter for a machine which is less than 70 kilo voltage and 2.5 millimeter thickness of aluminum filter for more than 70 kilo voltage equipment. So, this is the guideline recommended for the thickness of filtration. Moving on to collimator. So, what is collimator? Collimator is a part of the X-ray machine which is made of lead plate with a hole in the middle, which is used to restrict the size and shape of the X-ray beam and to reduce the patient exposure. So, commercially in the market you get a circular collimator and rectangular collimator. But looking from this image, we can see that in circular collimation there is excessive radiation and that is going to cause more harmful to the patient when you compare to rectangular collimator. So, rectangular collimator is the most effective in reducing patient exposure. Moving on to position indicating device. It is an extension of the X-ray device, X-ray tube head, which is used to direct the X-ray beam. Commercially in the market you get 8-inch long position indicating device and a 16-inch position indicating device. But when you look at the images, it is very clear that 8-inch PID there is more divergence leading to more radiation exposure, whereas in a 16-inch PID there is less divergence and hence less radiation exposure. So, similar to collimator, there is also a rectangular and a circular position indicating device available commercially in the market. When compared to circular, the rectangular position indicating device is always more effective than circular position indicating device. Now, what are the measures to be taken during exposure? You need to make sure that your patient is wearing a lead apron and thyroid collar. So, now what is this lead apron and thyroid collar? These are nothing but a flexible shield of lead that is placed over your neck, chest and the legs to protect your thyroid gland, to protect your reproductive organs and the blood forming tissues from the harmful effects of scatter radiation. So, it is mandatory that you make your patient wear a lead apron and thyroid collar during exposure. Also, you need to make sure that you have a latest technology available image receptor or a film. So, nowadays F-speed film are available which are 20% more effective in reducing the patient exposure when compared with the previously used E-speed film. And coming to beam alignment device. This device is going to help to stabilize the receptor in the mouth and also reduces the chances of movement possibly which can occur. So, following these steps during the exposure can reduce the radiation. Now, only with the proper technique you will be able to capture a proper diagnostic image. If you are not thorough with the technique, then there is going to be errors or artifacts which can lead to a non-diagnostic image and leading to re-exposure or retake of the radiograph. And what are the optimal exposure factors? So, according to the guidelines, a kilo voltage setting of 60 to 80 kV, milliamperage of 6 to 8 mA and the shortest exposure time possible will always give you a good diagnostic image. So, these are the ideal optimal factors which you should be setting in your equipment. And finally, what is after the exposure? Proper receptor handling and proper image processing or image retrieval is also very important. If any mistakes is going to happen during this procedure, it can also lead to artifact. So, when there is an artifact, it is going to contribute to a non-diagnostic image leading to re-exposure or retake. Okay. Finally, how can you apply these radiation protection. So now we've seen what can be done to protect the patient. So now we will be seeing what are the radiation protection measures for the operator. Operator can be dentist or a dental radiographer who is employed for taking X-rays. So there are radiation protection guidelines for distance and position recommendation and shielding recommendation, and there is radiation monitoring for the equipment and personal monitoring. First, let's see what is the distance position recommendation. Okay, so the radiographer should either leave the room or take a position behind the barrier or a wall during the exposure. Ideally, the dental radiographer should stand at least 6 feet away from the X-ray tube head during the X-ray exposure. When maintaining this distance is possible, it is mandatory that a protective barrier should be used. The dental radiographer should never hold a receptor or a film for the patient or should stabilize the X-ray tube head during the exposure. Now moving on to shielding recommendation. Protective barriers that absorb the primary beam can be incorporated into the dental office design, which protects the operator from the primary and the scatter radiation. Also, the dental offices should incorporate adequate shielding in the walls through the use of several thickness of common construction materials such as drywall. Next, a leaded glass window or the use of a mirror is beneficial to monitor the patient during exposure. What is equipment monitoring? So, what has to be checked in the equipment? So, the dental X-ray machine must be monitored for leakage radiation. What is leakage radiation? So, leakage radiation is any radiation that is emitted from the X-ray tube head apart from the primary radiation. So, when does this leakage radiation occurs? It occurs when there is going to be a faulty tube head seal. So, how can this leakage radiation be corrected? There is a specific equipment available for this purpose, which can be obtained from the manufacturer of the dental X-ray equipment. So, it is important that you monitor these machines constantly for leakage radiation, hence preventing radiation exposure unnecessarily. Moving on to personal monitoring, very important part. The amount of X radiation that reaches the body of a dental radiographer can be measured through the use of personal monitoring device. So, commonly used are TLD badges. So, what is a TLD badge? It is nothing but a thermoluminescent dosimeter. It consists of a piece of thermoluminescent crystalline material inside a radiolucent package. This thermoluminescent crystal is exposed to ionizing radiation. It absorbs and traps some of the energy of the radiation in its crystal lattice. When this is going to be heated, this trapped energy is released in the form of visible light. So, a specialized detector measures the intensity of emitted light, which is used to calculate the dose of ionizing radiation the crystal was exposed to. Hence, we arrive at a dosage called as absorbed dosage, which was absorbed by the body. So, what is it made of? This TLD badge is usually made of 3 disc or 3 filters, which is nothing but coated with a dysprosium doped calcium sulfate. You are supposed to wear your TLD badge over the chest region, above the normal clothing and under the lead apron. Your TLD badge can measure up to 100 microsievert to 10 sievert. Okay. What are the radiation exposure guidelines? The National Council on Radiation Protection and Measurement defines the maximum permissible dose as the maximum dose equivalent that a body is permitted to receive within a specific period of time. This dosage of radiation that the body can endure with a little or no injury. So, what is the maximum permissible dose? For an occupationally exposed person like a dental radiographer, the dosage is 50 microsievert per year, whereas for a non-occupationally exposed person like a general public, it is around 1 microsievert per year. So, these are the recommendations given by National Council on Radiation Protection and Measurement. Finally, I would like to say you have to follow ALARA principle. What is ALARA principle? It is nothing but as low as reasonably achievable. It is a concept that states that all exposure to radiation has to be kept to a minimum to protect both patients and the dental radiographer or the dentist. With every possible method of reducing exposure to radiation should be employed to minimize the risk. So, the radiation protection measures available can be used to minimize the patient and operator exposure, thus keeping radiation exposure as low as reasonably achievable. So, with this I have come to the end of my video, and I hope you have a good understanding on radiation protection, and I will be meeting you all soon in another video on another topic. Thank you.